talking about why drugs should not be decriminalized in the United States.
Realize that decriminalization is not the same as legalization. Decriminalization means that if you are caught with drugs, you will incur criminal consequences, such as probation, time served, or mandatory drug treatment programs. Our argument is against drug decriminalization. Having drugs readily available would not be conducive to breaking addictions. If drugs continue to be criminalized, individuals will be incarcerated for drug possession, making it impossible to use while in jail or prison.
Decriminalization. Decriminalization, as stated earlier, is not legalization. Decriminalization focuses on getting rid of penalties and jail sentencing for simple drug possession only. And according to the United States Sentencing Commission, simple drug possession is defined as a misdemeanor under federal law that provides an offender may be sentenced to a term of imprisonment of not more than 1 year or fined a minimum of $1,000 or both.
All right, so the opposing viewpoint for the decriminalization of drugs is we have determined that it's the wrong viewpoint because the misuses of drugs, it will affect our criminal justice system, the social living situations, and our healthcare system. Having a punishment to those who are doing the drugs illegally is a benefit because it can deter other criminals and drug users from using those drugs because of the punishments assigned to those types of crimes. Another reason why we believe the opposing viewpoint is wrong is because those criminals have to be punished for breaking the law and not rewarded and getting more drugs that they want. So the credibility and the bad evidence, we can see that we have not yet had a significant amount of evidence to prove that drug decriminalization will work. We don't have the programs, we don't have the funds for this kind of stuff, which is why we should refocus for not having decriminalization and having more programs put in place like rehabs and all those other kinds of stuff. The program that if they wanted to instill would not have, it wouldn't really be fair because they're getting rewarded for the crimes that they have committed in the past.
Richard B. Carell proposed that instead of simply making all drugs legal, we need to add some rules. His rules were drugs can only be purchased by adults, cocoa leaves could be bought at grocery stores just like tea leaves, granular cocaine would be illegal, you would be able to purchase cocaine gum in limited quantity, opium would be legal, heroin would be semi-legal, PCP would still be completely illegal. He proposed that anyone of adult age could purchase psychedelics if they could pass a written test about the effects of the drugs. Richard's proposal suggested that everyone would have a card to withdraw a certain amount of drugs per day or week. This would just open up new crime. People would be selling cards and trading their cards. He suggested that heroin would be supplied by addicts through a prescription. This would probably anger people that are not for drugs. It would be upsetting for them to know that these people are getting heroin for free through their prescriptions. Sophie, you're muted.
Some people do have a need for a deviant lifestyle. These people would go for the harsher drugs that were not made legal, like PCP, when before they might have only gone for something less intense like cocaine and leaves. Drug legalization would not end gang violence like some might think. They would find other gang activities to engage in. Completely legalizing all drugs do pose a massive risk to the public safety. Keeping drugs illegal does give people a reason to not engage in the use of them. Some people may not have tried drugs because they don't want to get in trouble with the law. They have that threat of arrest. Even society's values keep people from trying certain drugs. And making drugs legal would make it easy for anyone to feel safe and easily figure out where to buy drugs from, when before they would have never tried them in the first place. so experimentation would be on the rise.
So our supporting arguments for being against drug decriminalization, it makes it possible for others to become addicted. And the above will cause short and long-term health side effects, such as decreased awareness, reduced motor control, poisoning, depression, diseases like HIV that you can get from used needles. With the decriminalization of drugs, people will continue to add more illegal substances to increase the potency. These chemicals may be unknown to the buyer, which can lead to overdose and or death. Decriminalization of drugs does not mean drug dealers and cartels will stop their sales. If anything, they will increase the potency of their drugs, and because of this, supply and demand will skyrocket. I think if people put more things like fentanyl in their drugs, people that are addicted will be more willing to buy off the street than from the government.
When it comes to the statistics and results of legalizing controlled substances, there are many topics and factors that need to be considered. Spread of diseases is one of them, and it's a major concern. One of the main ways diseases such as hepatitis and AIDS can be spread is through shared unsanitized needle usage. So let's talk a little bit about Switzerland's needle park. The idea of it was to confine all users into one small space rather than having them freely use and roam through the streets. Unfortunately for them, this turned into a tourist attraction for the rest of the world. It became a gathering of over 20,000 addicts. It had to be forcefully closed, and it was on the verge of infecting the entire city of Zurich as cases of AIDS and hepatitis were dramatically increasing. Now let's take a look at Italy's decriminalization. Personal possession of drugs such as heroin is exempt from criminal sanction in Italy. Since this, Italy now has one of the highest rates of heroin addiction in Europe, and more than 60% of AIDS cases come from its addicts. Overdoses are also a major concern, as rates are continuously increasing throughout the United States with drugs being decriminalized. Fentanyl is commonly laced into hard drugs and can cause the user to overdose instantly, only after ingesting a small amount, and it's deadly to most all of its victims. The majority of the time, the user nor the dealer is aware of fentanyl being in the drug. A study conducted recently took data from Arizona, California, Denver County, Colorado, Harris County, Texas, King County, Washington, LA County, California, and Dallas-Fort Worth, and throughout more of Texas. They all showed an increase in fentanyl related to deaths and overdoses. Their collective contribution to national synthetic narcotics mortality increased 371% from 2017 and 2019, and data collected from 2020 shows a 63% increase in fentanyl-related deaths overall. Fentanyl traces in heroin, prescription pills, and stimulants also increased overall. So these numbers should only increase with legalization and increased usage. Now, I want to compare the legalization of controlled substances to the legalization of marijuana in Colorado. Many problems have arose ever since marijuana was legalized, first medically and now recreationally. Recreation use was legalized in 2010. In spring of 2009, there were over 20,000 new medical marijuana patient applicants, and over 250 new dispensaries were open just for medical marijuana. By the end of spring 2009, new patient applicants increased from an average of 6,000 a year to an additional 38,000%. And by mid-2010, there were over 900 unlicensed marijuana dispensaries in operation, according to law enforcement, and who knows how many of these were actually not discovered. Relating to deaths involving marijuana use, in 2009, it was reported there was an increase of 10% in fatal accidents in which the drivers of the vehicles were under the influence. And by 2014, these numbers almost doubled to 19.29%. And so this overall number increased by 41%. Overall, marijuana-related hospitalization increased from 6,305 to 11,439 from 2011 to 2014. The overall use of marijuana increased as well. In 2011 through 2012, uses increased by 51%, and for 2013-2014, usage was 104% higher than the national average. Now, these rates and usages are for adults, but what about juveniles? With less regulation, drugs would be easier to obtain and to come by for juveniles as well. Juvenile use of marijuana in 2013-2014 was 74% higher than the national average, as well as compared with 39% higher in 2011 and 2012. This shows usage as the years continue will also continue to increase for juveniles. There's also going to be an increase in the need for rehab centers, which could actually cause taxes to increase rather than decrease, as the government claims legalization can conclude. This would eventually become an economic burden for everyone.
So, as well as Switzerland and Italy, Portugal was actually the first country to decriminalize all drugs, marijuana to cocaine to meth. This was in 2001, following a national crisis of drug use and violence. So, some research found that lifetime drug use had increased slightly. Lifetime means who has ever tried drugs in their lifetime, not using it throughout their whole lifetime. Adolescent drug use had decreased for several years following this opening of drugs, but has since risen. And there's also no actual relationship between the punitiveness of a country's drug laws and its drug use. Drug use does tend to increase and decrease according to cultural, social, and economic trends. Overall, the data is conflicting, and most data is self-reported by the drug users, so essentially we are just trusting them to tell the truth with how much and when they use drugs.
So some of the benefits of drug decriminalization, it allows law enforcement to focus their assets more on serious crime, homicides, robberies, things like that. It lowers the amount of offenders in jail because most offenders are in jail. 43% are in jail for drug possession. So that would help decrease the overpopulation, which would help with the amount of money that we are paying for taxes per year for each prisoner. So that would decrease around 20 billion per year for the United States. Also, those caught with simple possession charges would be able to receive help via rehab without any criminal charges. So pretty much more users there are in rehab, the less users there on the street, which makes a smaller market for drug dealers to sell in, which also can lead to a lower chance of accidental overdoses and or death.
Current resources available for addicts are not ready for the influx of people that would seek these programs if decriminalization is or was or did become prevalent. So all the people that would start doing it would just absolutely storm in and overwhelm these treatment programs and rehab facilities. So we'd have to start more stuff like that. And also, if decriminalization became something that was nationwide or statewide, it would lead to an increase in the amount of drugs in the world. Now, this would result in the drugs being cheaper for the average person. And as a result of that, people would be more inclined to try and experiment with these drugs if that happened. So just to continue this part, we're going to go on to the next slide. Most people do not even come in contact with drugs, but if decriminalization is relevant in the state of Michigan or in the whole United States, it would increase the average person's chance of being exposed to them. So people who find substance abuse as objectionable usually find drug decriminalization they find that will send a confusing and bad message to kids. This could result in minors having an increased chance of experimenting with them. So if a young kid is always told his whole life that don't do drugs, and all of a sudden people are getting in trouble for them, and then they know people that are doing it and just getting help for it, they might be more inclined to try them. The last point I bring up is that dangerous criminals will be able to receive lesser sentences for drug-related crimes. Now that just meaning instead of getting jail time, they'll be sentenced to rehab or something along those lines.
Legalization is not the route that our country's criminal justice system should take because it reduces the number of people swept into the criminal justice system for drug violation. Decriminalization also removes penalties for drug law violations, which could lead to the increase on war on drugs, long-term health issues, and more problems throughout society. However, by saying no to decriminalization, there will be a decrease in the spread of diseases, the overdose rates will decrease, and there will be a decrease in criminal offenses caused by addicts whose minds are altered. Say no to decriminalization to make our country a safe place to reside.